So we have Bert Logan, who is a doctor in physical therapy, and today Bert's going to be giving us some ideas of what we can do about lower back pain. And then we have Christine with us as our wonderful model that's going to be modeling some of the things that Bert is talking about. So Bert, lower back pain, man, it just seems like that is so prevalent in our society. And no matter where you are in the world, there's just so many people with this. So what's going on with lower back pain? Why are so many people have this?
Before I answer that question, though, let's talk about kind of what the low back is.
Okay.
If we could just anatomically. So, your low back is obviously down here in the lower part of your back, right? We got cervical, your thoracic, and then lumbar. So low back is that lumbar area. It's the five vertebrae down here in the low portion. So that's what we're going to be talking about today. And in between the bones, you have vertebrae, okay? And then attached to those, we have muscles and ligaments, all right? And so that's what people experience when they have low back pain, is getting those out of alignment. And that
the vertebrae or the muscles and ligaments or all of it?
Well, it can be all of it, actually,
Okay.
depending on the injury.
Oh, okay.
But I'll give you the three most common causes of low back pain. Number one would be poor sitting posture.
Okay.
And that's something that is preventable, that we all can correct, and we're going to be talking about that today. The other common cause is frequent forward bending, so doing a lot of this motion, okay? Or walking like this. That puts a lot of pressure on the low back, and that can cause muscle strain. So that would be cause number two. And then the third big cause of back pain is lifting objects which are too heavy for you to lift up. Okay. So I wanted to also talk about when you should seek help when you're experiencing back pain. A sign that you should go see a doctor, get some medical help, is if all of a sudden you've lost motor control of a leg. So if all of a sudden you notice that you can't move your hip or your knee or your ankle, that's a sign that
there's a problem.
There's a problem,
yeah.
Exactly. And I need to go seek medical attention.
Okay.
Okay.
Is that something that happens just like for the first 5 minutes when I get up in the morning, or is that something that all of a sudden people can't use their leg anymore?
It usually comes on suddenly.
Oh, okay.
So that's obviously abnormal, right?
Right,
and that's
okay.
a sign that you need to seek medical attention.
All right.
Yeah. The other reason that you would want to seek out a doctor is if all of a sudden you lose bowel or bladder control. Okay.
Mm-hmm.
And that can happen from impingement of nerves in our low back.
Really?
Yeah.
Okay.
Because the nerves that control bowel and bladder, they go through your low back. So if you have any problems there, let your doctor know.
Oh, okay.
Okay. Yep. And then, obviously any significant recent trauma, like a car accident, falls, that's a sign that you need to go see your doctor.
Okay.
And seek out help.
So other than that, you just have a sore back, and that's kind of what we're talking about today, right?
Right, exactly.
Yeah. Not to go see your doctor, but I got a sore back. It hurts all the time.
Right.
What can I do? Yeah.
Exactly.
What can I do about this?
Exactly. So one thing I want to say, we're going to talk about some different stretches that you can do to treat low back pain. But I also wanted to talk about that use of heating pad or ice can be a great modality to help treat low back pain.
Okay.
So if you have access to a heating pad, putting a heating pad on your low back for like 10 to 15 minutes on a low setting can help. Now, if you're in a place or some part of the world that you don't have access to, electric heating pad, trying to somehow heat up like a
towel?
A towel, right? So however you would heat that up.
Maybe put it in boiling water or something.
Boiling water,
Yeah.
but what you would want to be careful about
Right. You
is
don't want it too hot.
Make sure you don't put that directly against the skin, Jim. So it's in boiling water. Take it out.
Yeah.
You know, put it in like a pillowcase, and then put that against
Make
the
sure
skin.
make sure and touch it. Yeah.
Exactly.
Yes.
The other thing that you should do, and this is whether if you're using a heating pad or the method you just talked about, is after you take the heating pad off, have somebody inspect your skin. And what you're looking for is, it's okay for that to be red, but if there's any boils on the skin, then it's too hot.
Oh, okay.
And you've created a new problem. So I'm
yes.
glad you brought that up. So you have to be really careful when you're using heating pads. So we're clear on that?
Yeah.
Okay. Yeah. And then the other modality that a lot of people like and get benefit from is using ice packs. You can use an ice pack, or some people will even take a little paper cup and freeze water in there.
Okay.
And then you take it out after it's frozen, and you take off the paper, and you can just do like a little ice massage on the low back.
Okay.
And that sounds kind of uncomfortable, and it's kind of shocking, but that ice can help cool the muscle down
And shrink it. Does the ice
yeah, it shrinks it, and the
okay.
heat will help relax the muscle. So
okay.
what I tell folks is try both, because heat might work for you, but ice not, and conversely, same thing with Christine.
Okay.
Just the opposite might work. So that's why I tell people try either.
Okay.
And see what
How
works for
long
you.
would I put ice on?
So ice is more uncomfortable. So
Right.
you're going to go less time. If you're using an ice pack that's on your back, I'd say maybe 5 to 7 minutes.
Okay.
If you're using the little the cubes, you're probably only going to do like maybe 3 minutes.
Okay.
Versus heat is usually more comfortable.
Right. I can go to sleep with the heating
and
pad
like
on.
15 to 20 minutes on heat.
Okay.
Yeah.
All right.
So
Very
those
good.
are two great modalities that you can use in the treatment of low back pain. So the other thing that can be really helpful is just rest, right? You're experiencing low back pain, and that's your body's way of saying, hey, something's out of whack here, right? And maybe you've just been hustling and bustling, between school and work. It's your body, body saying, hey, you need to
Slow down.
back off a little
Yeah.
bit. So 1 or 2 days of rest can be really, really helpful.
Okay.
The other thing I would say that you can do, and this is something that you need to talk to your doctor about, is the use of like Tylenol. That's anti-inflammatory, and that can help reduce pain in the back. That's over the counter here in the United States. But I still advise people to talk to your doctor because anytime you're taking even over the counter, it can affect your kidneys.
Right.
Right.
Yeah.
And so you want to talk to your doctor whenever you're taking anything like that.
Okay.
Yeah. So then the other thing that we can do is gentle self-stretch exercises for the back. And we've actually made a couple of videos on stretching. So if you haven't seen those, you can refer to that.
Absolutely, yeah.
Right? So one stretch that we're going to start with is having you to lie on your stomach. So I'll take this pillow out of our way. And you know what? We're going to take this pillow out too, because that's going to be in your way. And so you can just put your arms by your side and then your head turning right. So laying in this position, we call this prone. It just means you're lying on your stomach. And I would recommend laying here for, try for 1 or 2 minutes and see how that feels. And what this is doing is just kind of stretching out the spine. If I were in a flex, we call this flex position, what Christine is doing is we're extending the spine here, okay?
So on a harder surface, or does a real soft surface work for this?
Thank you for bringing that up. No, soft is not good.
Okay.
So you really want to be on a medium to firm surface.
Okay.
Because if you're too soft, then the spine is going to be, instead of in a straight line, it's going to be kind of like a curved C, and that could cause more problems.
Okay. So a quilt on the floor or something like that
Yeah.
would,
And so on the floor would be fine if you don't have access to a bed or a table.
Mm-hmm.
Yeah. Yep.
Okay.
All right, and so then if this position feels good, then the next thing you're going to try is you're going to come up onto your elbows. So just, and actually bring your elbows back even, so yes, there we go. So you're about right there. So we went from fully flat to, you can see now her upper spine is extended a little bit. So, and then holding that position for another 1 to 2 minutes. And on all of these positions, Jim, I would say, if the stretch is causing pain, then you need to stop it.
Okay.
Or go back to the original position.
Okay.
Because we're not trying to increase pain, right?
Right,
We're
yeah.
trying to reduce pain.
Right.
So are you doing okay, Christine?
Yep.
Okay. Very good. And then after that, if that feels good, then we're going to come up even into more extension. So I'm going to have you come up onto your hands. Okay. There we go. So she's getting even more of a stretch here. Is that comfortable
It is.
for you? Okay. And then.
And how long would you hold a stretch like that
Well,
for?
I would probably just do that for about 5 seconds and then come back down onto your elbows. Okay. And then, you would come back up and probably do like 5 repetitions of that.
Okay.
Yeah.
And everything very slowly and no pain.
Exactly.
Okay.
Right.
Very good.
Yeah.
Very good.
Now, initially, if you have low back pain, you might not be able to come up this high, and that's why you start with just laying on your stomach
laying flat.
with your arms by your side. Yeah.
Okay.
Okay. All right. So the next stretch, well, this isn't really a stretch. This next technique, we call it a pelvic tilt, and it's to help to stretch and strengthen low back. So what I'm going to have Christine do is to roll onto your back. Think about, in your low back, we call that lumbar spine. There's a curve there. There should be a curve,
right.
Okay? And what you're going to do is you're going to try and flatten that curve. So what I tell people to do is think about your belly button, and you want to push that belly button down towards the table or down towards the floor, right? So, and when you're doing that, you're tightening those abdominal muscles. So, and if you want, you can put your hand on your tummy so you can kind of feel it. Go ahead and push your belly button down towards the table. And I don't know if you can see on camera, but Christine's pelvis is kind of tilting up. Okay, so you would hold it for about 5 seconds, and then go ahead and release, go down. So go ahead and do the tilt. So press down, and yeah, your pelvis is coming up. So if I'm standing here, this angle here, so I'm laying flat, right? And the pelvis is tilting like that. So it kind of comes up off of the table a little bit. Yeah, and do you feel your back kind of flattening out?
Yeah, I do.
Right. And this is a pretty comfortable technique for most people, Jim. So does that feel okay?
It's very comfortable.
Right. And then from this position, another great thing you can do we call knee to chest. All right. And this next one is going to help stretch out hamstrings and the low back muscles, those lumbar muscles. So Christine, I'm just going to have you bring this knee towards your chest. And then you can put hands behind your knees, and then you're just going to gently pull towards your chest, okay? And then you would hold that for probably a good count of like 5 to 7 seconds, Jim. And then you'd bring it back, just like kind of release there, and then bring it back. So doing like about 5 repetitions, and I would do that on both sides.
And you're not bouncing it or
Thank you. No, not bouncing, exactly. We mentioned in our muscle stretching video that all stretching should be slow and prolonged versus fast and bouncy.
Bouncy, right.
Otherwise, you can tear the muscle fibers.
Okay. Yeah.
So thank you for that reminder. So that's single knee to chest. Now you can also do double knee to chest, where you're bringing both knees. So I'll help you, Christine. So you're bringing both knees up, and then you can put your hands behind and pulling. The other, so that's one hand hold. The other thing you can do is putting hands here. So, yep. So whatever feels more comfortable to you, Christine. And you can feel that stretch, right?
Yeah,
In the
I
low
can
bottom and in the back, yeah. So that's double knee to chest. You can also do that particular one, Jim, sitting. So if you have a chair, you're just leaning forward down towards the ground.
Okay.
That's the other way you can do that. The other thing I'll say about a physician is, they may or may not recommend some prescription medication.
Right.
So that's a conversation that you would have with your doctor, obviously.
And we're being very careful when we're talking about Tylenol because we're not prescribing anything here. But obviously, if somebody takes a Tylenol every once in a while, that's pretty much, not a big deal. But if you're taking it continuously, there's you really need to talk to your physician.
Absolutely.
Am I safe in saying that, Bert?
Yeah.
The way I said it?
For sure.
Okay.
Yeah. I always err on the side of caution because, we're all unique.
Yes.
But we have, your kidney has to process everything that goes through your body. So, yeah. All right. Well, we're going to finish by talking just about basic sitting and standing posture. So if you want to sit up, Christine. And that's the other thing in treatment of low back is maintaining good sitting and standing posture, Jim. So if you can show me a good slouch, can you slouch for me, Christine? Can you slouch more than that? Okay.
Slouch with your shoulders.
Yeah, right.
There you go.
So Christine has really good posture. Let me move this pillow out of our way there. So just really slouching over. So this isn't good on our back, Jim. Right? Okay. So when we're sitting, if you can sit up nice and tall, right, we got the pulling the shoulders back. And if you're sitting properly, so you can see, I don't know if you can see Jim, she has a nice curvature in the low spine. That's the normal curvature that our lumbar spines should have. So if you work a lot, say at a computer, right, sitting, one thing you can do to help maintain good sitting posture is using like a small pillow like this. If you don't have that, you can even grab a small towel and roll it up, and you would just put it here
in the small of the back.
And here's the chair right here, right? And that just helps maintain that lumbar, we call that the lumbar curve. Yeah.
So, people are sitting on medicine balls.
If you can safely sit on it, Jim, without rolling off, go for it, right? The first time, maybe hold on to the table.
Yeah.
But yeah, no, that's good. Good sitting posture, we talked about that. And then just to kind of wrap things up, if you can stand up, Christine, we'll talk about good standing posture. So, if you can give me a good slouch, Christine, right?
She's not much of a sloucher.
I know. Can you slouch more? You've got really good posture, Christine. Our model, is struggling with poor posture. I'll give you poor posture. Here we go, right? So you see people like this out in the streets, and we don't want that, right? So again, it's upright, chest out, right, shoulders back. Think about. You have a line going through your body, right? If there's a line going straight down, it should go pass through your ear, down through your shoulder, your elbow, your hips, knees, all the way down. So just imagine like a plumb line, right, going down, and that's what you want to try and emulate. So all of those things, Jim, are going to help in the treatment of low back pain. And are things that everybody can do. Maybe I'll just end by saying, after you've done some self-treatment for, I would say, 4 to 5 days, if that pain is persisting and after you've done all of these techniques, then definitely go seek out, more medical attention from your doctor.
Good advice.
And they can do more testing. They might do some X-rays, to see if there's more of a problem that can be worked on by the doctor. So
good. Yeah. So good diet, good exercise, good stretching. We talked about walking in other videos, how walking can help your back, and so there's a lot of things we can be proactive and that we can do to keep healthy and to not be in pain, because
Right.
pain is horrible. I don't like being in
Absolutely.
pain.
No.
So, hey, thank you very much for watching this video. And hey, if you like this video, we've got more just like it. Hit the subscribe button below, watch more videos, like, share, whatever you need to do. But we love having you on and watching this right now. So thank you very much for being with us. God bless and have a wonderful day. We would love for you to be a part of our Ultimate Mission family. Please subscribe to our channel, watch our videos, like and share our videos, donate if you would like. Let's work together to spread the gospel of Jesus Christ to the world.